Our very first year in 2018, we transferred just about 3,000 patients. And this year, we're on track for 7,000, many of whom come from system hospitals and others who come from as far away as Vermont and other parts of the United States. Last week, a patient from California.
Just about 5 years ago, I suffered a very, very bad heart attack. Luckily for me, I live in White Plains. I went to White Plains Hospital, where the surgeons and nurses there saved my life, we said about 6 times. Brought me back from the other side of the river. When it was finally decided that I had to go someplace else, the transfer center set me up at Moses. When I got there, the team was ready for me. And my wife, who's been a medical professional all her life, said to me that that was the best trauma care she's ever seen in her career.
One of the most important things that we did was we hired the right person to run this. And Brittany Cintron, I really want to thank you. I want to thank you for everything that you've done. I want to thank you for believing in our vision. None of this is possible without the support of someone who shares our vision and who wants us to behave as one system. And I'm delighted to introduce our President and Chief Executive, Dr. Philip Oswald.
Thank you very much. Thanks, Peter. I'm really honored to be here. You know, in human physiology, there's something called the central nervous system that controls executive functions, including functions of movement, thought, and processing. In systems management, there are emergency services. If you're home and you get sick and you need to come to the hospital, you call 911 if you can't move yourself. So who does the hospital call when they need to move someone? And by definition, if you're in a hospital anywhere, or you're in a doctor's office and you need to be moved, on average, you're much sicker and much needier than everybody who's home calling 911. And so whether you're in a doctor's office in Westchester and you need to come in and get a bed, or you're in a bed in the emergency department and you need to move to a different part of the hospital, or you're in a bed in the hospital and you need to move, it means that you need a higher level of care, a more complex level of care. And if you happen to be in one of our locations around our system, around the various areas where we render care, and you need to be moved to another location, that's even a higher level of complexity and a higher level of need and a higher level of specialty. So who do we call? You, all of you who work here. This is the central nervous system of our system. And without this, we can't do any of the things that we want to do. We can't transform health, enrich lives, improve outcomes, integrate, care for all the people that seek us out for their care. This is central to all of that. And this is also central to a vision that we have to help to elevate other systems and other healthcare facilities. So I see into the future, I see this we were just talking with Dipesh a little earlier. I see this serving not only our health system, but others, because the level of excellence and efficiency that you're exhibiting here, others can benefit from as well. I do want to thank so many people, all the 50 or so folks who work here, for the dedication that you bring to it and the excellence that you bring to it and the passion that you bring to it. It shows. I've seen the numbers. I hear from people who have benefited from your expertise and care. They don't even know, who you are. They don't know your names, but it's like last week I flew from Chicago to New York, and I can't tell you the names of any one of the air traffic controllers who were working behind the scenes, but I can tell you I'm really grateful that they were there. And that's the only way that plane got here safely and didn't run into some other plane and so on. So let me also, yes, I know I thank God for air traffic controllers every day, and that's the way that I feel about all of you who work here. You are air traffic controllers. Many thanks to David Veras, who was very instrumental in making this happen. I see some of the key people here. Dr. Adrian Wasserman, thank you. Brittany, also Al, but both of you run the day-to-day here every day, and thank you. I see the results of that. I also want to thank Raven Carter, who's for everything that you do to help us improve patient care and outcomes. And I want to thank the boss, our regional senior vice president for New York City and everything else. Peter Semchek, for all that you do, Peter, to transform our system and all that you do to help us drive better patient outcomes and what you do to help us drive growth as well as sustainability. It is crucial to everything that we do, and this is your vision, and I can see why, and I can see where this will go. So thank you to all of you, and I'm really happy and honored to be here and to say thank you.
I'd like to introduce Raven Carter, who has spent the last number of years making sure that this dream of ours became a reality. So, Raven.
I want to thank you all for being here to share in the realization of this magnificent vision. When I came to Montefiore about 6 years ago, I tell this to anyone who'll listen, quite frankly. So when I walked through the door, I felt a sense of family, and I felt a sense of commitment to our community. And I stay here for those very same reasons. This open space is a blank canvas for us to make a difference. So I'm going to turn it over to Brittany and Albert, and Brittany will introduce a very special guest that we have here today.
We've touched a lot of lives, many that we have been able to meet, which has been a huge reward for both Albert and I. And tonight we have the pleasure of having one of our patients who was transferred from White Plains Hospital to Moses and had an outstanding recovery through the transfer center. So we're going to welcome Jim Bradley.
Just about 5 years ago, I suffered a very, very bad heart attack. Luckily for me, I live in White Plains. I went to White Plains Hospital, where the surgeons and nurses there saved my life, we said about 6 times, brought me back from the other side of the river. When it was finally decided that I had to go someplace else, the transfer center set me up at Moses. When I got there, the team was ready for me. And my wife, who's been a medical professional all her life, said to me that that was the best trauma care she's ever seen in her career. They saved my life that night. Very luckily, the next morning, Dr. Yordi and the heart failure team came in. Dr. Goldstein and the surgical team was there. They put an LVAD in my heart. Lo and behold, on a given morning, they brought me back from the brink. Eventually, I went to Burke. They got me standing and walking and moving around, and I was home by Christmas with my family. I have to tell you, though, it's more than just the medical care I received. They took care of my family. When we were at Moses, Brandy Kaplan took care of my wife. Whether it was Susan Fox sending my wife a handwritten note that I'm going to be okay, Peter coming to my room and saying to Robin, "It's okay. We got it. He's going to be fine." Now I'm 73. I'm traveling around the world. I'm as happy as could be, and it's because of the people at Montefiore. I told you I was the chief of police in White Plains. If I had a tattoo, my wife would let me get one. It would say command and control, because I'm telling you, there is nothing more important than what's going on in that room. I've handled hurricanes, riots, murders, everything under the sun. You have the stakeholders in the room, and a decision is made. You can't do it any other way. What you're going to accomplish and what that's going to grow to for you is just amazing. So again, I'd like to thank you all. I wish you all the best. Thank you.